Two, going live.
Hello, you guys. It's Dr. Vidal, and we are back with Tuesday Tips. We tend to meet every Tuesday afternoon to discuss different topics in plastic surgery, and I get to answer your questions. Thank you for joining today. Today, we are going to be talking about a popular topic in and out, and a common question. I'll keep the topic short so we can get to the questions afterwards, okay? So, I want to remove the implants, but I don't know if I just want to remove them or I want another implant to put in, okay? So explant or implant exchange, okay? The majority of patients that have this concern or doubt is patients that obviously had implants done many years ago, and for whatever reason, probably 10 plus years, for whatever reason, now they feel that they need a reshaping of the breast, okay? Either they're too droopy, they had kids, they breastfed, life went by, and now they're either droopy or too big, or they just want more cleavage, more lifted, whatever reason it is, right? But those are the most common. And a lot of people also have the concern of breast implant illness. So I wanted to talk about those two things. The first one is the time with implants. So a lot of people are concerned because it's like, oh, I've had my implants for 10, 15 years. People say that I need to change them at 10 years. I've been with them longer than that, so I think I need to change them. So what's the reality of that, okay? The reality is that implants, the ones that we put now, don't have an expiration date, right? They don't need to be changed or removed after a certain amount of time, okay? When we hear people talk about the 10-year mark, is because the majority of the studies that they did on implants is patients being followed up for 10 years. So that's the 10 year that everybody talks about. But it doesn't mean that at 10 years they expire and you need to take them out or change them. No. If you're not having problems with the implants, you don't need to change them or replace them or remove them, but you do need to check them. So what does that mean? Going to a plastic surgeon, get a physical examination, check your implants, make sure you don't have capsular contracture, you don't have asymmetries, you don't have pain. The other important thing is if you have gel implants, to get an ultrasound or an MRI to check that the implant is not ruptured, okay? With time, the implant shell tends to get thinner, wear and tear, right? So that gets thinner, so the risk of rupture increases with time, okay? So if you have your implants done 10 plus years, get an ultrasound or MRI, get a physical examination by a doctor, check your implants. But if you don't have any problems with them, no pain, implant is not ruptured, you don't have to change them, okay? Unless they are textured implants, okay? And I put this here. Textured implants were done very frequently in the States, but more frequently outside of the United States, very commonly, because it was said that they had a decreased risk of capsular contracture, which is true. Textured implants have a decreased rate of capsular contracture, but in, I think it was 2015, around that time, we started to see a lymphoma associated with textured implants. It is called breast implant associated anaplastic large cell lymphoma, okay? This big word just means that implants that are textured have been associated with an inflammatory reaction in the body that 10 plus years later may create a seroma or fluid afterwards, and it may develop a lymphoma, okay? If that's the case, then you need to go to a specialist in breast implant associated lymphoma, implants removed, sometimes you need chemotherapy. So in the United States, since 2018, I believe, we have to check that date, but 17 or 18, textured implants were removed completely from the market, okay? So nowadays, if you're having implants put in the United States, they are not textured implants. But if you have implants placed 10 plus years ago, you may have textured implants, okay? If you have textured implants, you need to change them, replace them, remove them, okay? Because of the risk of lymphoma, okay? So if that's the case, yes, you need to go and change them. But just time-wise, you don't need to, okay? And let's talk about breast implant illness. Breast implant illness is a condition that has not been well defined, okay? So that's what it's called, illness and not disease. When we call it in medicine a disease, is that these are the symptoms, it's associated with this, and we know, and this is a treatment. Breast implant illness is a conglomerate or a group of symptoms that has been related to patients that had implants, but a connection with the implant has not been established. There are multiple studies, especially in the last year, trying to find the connection between the implants, but we haven't found any connections. We have found there was a study published last year that it investigated patients not only in the US, but Australia, London, multiple different areas internationally that expressed or felt those symptoms, had the implants removed, and those capsules and the blood on those patients were examined to see if they had toxins, if they had allergens, if they had antibodies against the implant, and there were none. No symptoms, no signs of silicone in the blood, toxins, or anything like that. So till this date, I'm not saying that we'll find something in the near future, but till today, there has not been an association of the implant causes this disease, okay? So that is why we keep on saying, and it's FDA approved, and we keep on putting silicone in saline implants because they are safe. But the reality is some patients do experience some symptoms. So if you are one of those patients, you need to go to a plastic surgeon to get them evaluated. And the possibility of an explant may be the solution for your symptoms, okay? What are usually the symptoms that patients experience is fogginess, fatigue, joint pain, symptoms that are very non-specific. So you do need to go to your primary care and get a full workup, because most of the time patients that start to complain about this, they have thyroid problems or other hormonal diseases, right, that explain those symptoms. But if everything else is negative and you're still feeling like this, then the solution may be to remove the implants. And if that is your case, if you are having the removal of the implants because you connected to breast implant illness, I do not advise putting another implant, okay? Because it probably means that your body is reacting in some way we do not understand right now to implants, okay? So in those particular patients, then you need an explant. I do not advise to place another implant, okay? But if you have textured, you may want to explant or implant exchange. And if it's just time, depending on, because you want to lift them because it's droopy or anything like that, you may want both. So how do we decide, right? If I just want them removed, or I just want a smaller one, or I just want another one, but I'm not sure, okay? This is the most important aspect to consider. Final volume and final shape, okay? So you need to kind of understand what are your goals. So what helps? Seeing a lot of pictures of patients that had it done before, and understand two things. When you explant, you're just leaving behind your breast tissue. So your breast is going to be smaller, okay? And the shape of the breast is going to be more of a teardrop with the nipple here rather than more fullness in the upper pole. This is implant. This is a natural breast, okay? If you're okay with this, perky, lifted, but okay with a teardrop natural shape, then you may be okay with just an explant, okay? But if you're not happy with this, and that is a very personal decision. A lot of patients ask me, oh, you're the doctor, what do you recommend? No, I mean, there's some patients, and I'll talk about this in a few secs, that I do advise putting another implant, but the majority of patients, it's up to you. What shape do you like? When you're putting a bathing suit, when you're putting a dress with cleavage, do you like that roundness and that fullness, or you're okay with a more natural look, okay? That's a very personal decision. So that's gonna be one of the most important decisions, knowing if you're okay with an explant or if you're okay with an implant exchange. And the other one is how much breast tissue you had before the implant, okay? If you were an A cup before the implant, you are going to be very flat after that implant is removed, okay? Are you okay with being flat again, or you want some volume? And that's the only case, if I examine you and you have barely no breast tissue, I'm going to advise putting probably a small implant, okay? unless you have symptoms of breast implant illness, okay? That is the only alternative, which I may consider fat transfer to the breast, okay? Fat transfer to the breast, it is not, people think that it's gonna make it round and perky. It's not gonna look like an implant. Fat transfer to the breast is gonna look more natural. It's just adding a little bit more volume and thickness to the tissue, but it's not gonna give you that shape of an implant, that round shape, okay? And the other thing with fat transfer is, if you're an A cup, you don't have a lot of breast tissue, so fat transfer is fine. But if you have more breast tissue and you put fat there, some of that fat may not survive, and we may end up with fat necrosis. Fat necrosis under ultrasound or mammogram may look like lumps and bumps, similar to what breast cancer looks like. I'm not saying that fat transfer to the breast leads to breast cancer. No, but it may look like lesions that may appear as cancer, which may lead to abnormal mammograms, biopsies to rule out cancer, and more stress to the patient. And that is why I don't usually do fat transfer to the breast unless it's an explant case that was an A cup and has barely no tissue, and we need to kind of shape and put something there after removing that implant, okay? Let's take some questions now.
Okay. It's always possible a tummy tuck even if we decide for lipo 360 first?
So if you are doing lipo 360 first and then decide to get a tummy tuck, is one thing. But if you have excess skin and muscle weakness, that I advise you to get a tummy tuck. Doesn't matter, like you'll need a tummy tuck to correct that. It's better to do the tummy tuck first and then do a lipo 360. If you have very mild skin laxity, we do the liposuction, and you have some loose skin, we can do the tummy tuck afterwards. But the reason why I prefer to do the tummy tuck first is the lipo leaves scar tissue in all the areas that we lipo, right? And when trying to pull that skin like an apron and remove that excess skin, sometimes that scar tissue doesn't allow me to pull it evenly. And you may end up with some irregularities after the lipo and then tummy tuck. It's better to pull it up, have everything tight, and then come back to lipo 360 if you need it and want to, rather than the other way around.
Hi, can I have lipo and breast reduction at the same time?
Depends on the areas of liposuction. So I operate in Miami, Florida under an office-based surgical facility, which by the Department of Health here in Florida limits the amount of liposuction I can do because of safety reasons. I'm not in a hospital, and the resources that I have available are less than a hospital. So I need to keep the procedures short and safe. So when I'm doing a breast reduction, for example, or any open procedure, a tummy tuck, brachioplasty, anything that involves excision, the Department of Health limits me to do only 1 liter of fat, okay? So if you are considering a lipo 360, it's better to do it separate, because for lipo 360, I'm definitely need or will remove more than 1 liter. But for example, if you want to do lipo to the arms, that can be added with a breast reduction, or just you don't have a lot of fat and you just want to do the belly and do abdomen, we can do a lipo 180, just the abdomen and the breast reduction.
How long do I know that my transfer fat is already mine?
6 weeks to have new blood supply, so that's when it's good to sit and apply pressure to the fat grafted areas. But final result with the fluffing may take up to 3 to 6 months. So what is the fluffing? Now that those cells have the new blood vessels at 6 weeks, they start to get nutrients, okay? So those cells may expand and kind of relax, and that's the fluffing phase. And that may take up to 3 to 6 months, okay? So 6 weeks for the blood supply, but you may see changes still for 3 to 6 months.
Another question here. Can you pair a facelift with an upper back or thigh lift?
I don't. I prefer to stage those, okay? I prefer to do a facelift alone. The facelift surgery is a surgery that requires a lot of finesse and takes time, okay? Because it involves one side of the face, then the other, the neck. And I like to give my 100% attention to that surgery to get the best results possible. If I'm adding other procedures, then I'm trying to kind of speed up the facelift to try to get to the other procedure, and that's never good. So facelift, I like to do it alone. And a thigh lift, I like to do it alone because of the recovery, okay? So a thigh lift is one of the surgeries in plastic surgery that has the highest risk of wound openings. The incision is near your genitalia. It's an area of the gravity kind of pulls all the swelling down, tension in the area. You're moving your legs because I want you up and walking to avoid blood clots. So all of those things contribute to wound healing problems. So it's better to do it alone, so focusing on that recovery to try to get the best results.
And the last one, what to do when you get dog ears after tummy tuck? She put dog ears.
Oh, dog ears. Okay. So dog ears is something that can be treated and resolved very, very easily. It is just done under local anesthesia, just numbing the area, like in the dentist numbing, lidocaine in the area, removing that excess skin and suturing it, and you can go back home the next day or same day if we're doing it early on the day. So something that can be very, very easily be taken care of in the clinic. Awesome, you guys. Hopefully this helped elucidate a little bit about the Explant versus putting another implant. If you have any questions, let me know, and I'll see you guys next Tuesday. Oh, no. Wait a second. I am going on vacation, so I am going to Mexico for Dia de los Muertos. I'm very, very excited about this. I got my nails too.
Yeah.
For Dia de los Muertos. So I'll post some pictures so you guys can enjoy this. I'm very excited, but I won't be available for next Tuesday tips, but I'll be back the following week. So I'll see you in 2 weeks. Tuesday tips, don't miss it. Take care.